Welcome guys, from this side is Body Fix by Adam. In today's video with me is Shahir. He is a Brazilian Jiu-jitsu fighter, and in today's video we're gonna show you how to address and fix common injuries in Brazilian Jiu-jitsu. Tell us a little bit about yourself. How long do you train and what kind of injuries or issues do you have in your body, and so we can see what we can do, how I can address his area.
Okay, my name is Shahir. I'm Kiwi. I've been doing Jiu-jitsu for the past 8 years. If you're a common fighter in Jiu-jitsu and when you go to competitions and stuff, the sports requires a lot of different movements and a lot of different explosive movements, let's say, in that point. So you get to use one side more than the other because you're playing either a guard or if you're playing on top. Depends on how you're positioning in the game. So you end up using sometimes one side more than the other, which causes a lot of muscle imbalances. This is what Adam's gonna help me work on with today. This muscle imbalances causes some injuries. So it causes a little bit tightness, causes some
restriction in the movement, yes.
Exactly, some strain in the movement, causes some lack in mobility in some sides. And also when sparring with someone or going into competition, it's a fight against someone else. So you end up getting injured. These injuries, when we don't take care of them, they accumulate over the years, so we end up all damaged.
So this is very specific and contact sports and requires a lot of efficiency. So in the movement and also like putting pressure on one side. As we can see, most of the athletes, they have one side bigger than another one. And one is a smaller part, one bigger. Often we are leaning on one side of the hip, for example, and then the pressure is transferred through the connective tissue chain. So it's very important to address those problems and fix to be able to get the athlete ready for the competition and start to prevent those injuries happen for the future time. Yes. So how we can check? Yes. So first thing, when we getting, okay. So as we can see, we have an athlete from the front view. Yes. So we can see that the one shoulder, for example, yes, in here, one is lower, one is higher. Yes. So we have in here. From here we can start one, yes, the point, other point, second, scapular, you can see the clavicle. So as we can see in here, this part is smaller, this one is bigger. We can see as well in here, if we lift over, yes, so we are leaning more on this side, so we have one bone, another one of the hip, so we can see the hip shift. Yes, so 100% is gonna tell me that he is leaning on that side, yes, in putting much more pressure and weight on this hip. As you can also, you told me before that whenever you are in your position, you are all the weight on the one side, yes. Then what I can tell as well, yes, when we lift the one leg, stand up on the one, okay, and in here is much less balance, yeah. When you lift again, stand up, one more time, yes, it's same, okay. Here you can see that he is shifting to the side, but the stability is much better, yeah? So he is used to stand up or moving or rotating on that side. And one more time, other one, okay, and here, yes, we are shaking. Yes, if I'm gonna lift in here, totally, yes, about the balance. Yes, and show us the position when you are moving. How do you go?
So I'm always technically on one side more than the other. So from here, I'm always fighting on this side. So my preferred side would always be this side.
Okay.
If I switch on the other side, I feel it's very uncomfortable, or it's not my dominant side.
And it's not your strong side, that you will be able to press on. Yes. So if you're rotating and you're pushing someone, you're rotating that side. Yes. Okay. So 100%, we're gonna see that he's gonna use a lot of adductor on this side and also hip rotators. Yeah, but putting pressure on the other one. Yes. So then this side is gonna be under pressure, and then the muscle tape is driving on the other side. So then left shoulder, and you're also feeling that your left shoulder is much more, yes, under, yes, pressure. Okay, so lay down normally straight. Okay, what we can do as well. So yes, we can check the rotation for the external rotation. Yes, so when the shoulders should normally be relaxed, they should touch the floor. Yes, in here is a missing, so I can tell that the chest is overworking in here of restriction in the external rotation. And then internal rotation, opposite as well, yes? Okay, so also, yes, as we can see here is better. This one, more limited in the range of motion. And then range of motion here, if I press on the lats, and here the pain starts, yes? And then Also, when I'm pressing in here, it's showing me how much limitation is coming from the back. Yes, the shoulder should drive all the way without any pain in here. We are missing quite a lot. Yes, and then other side. We go pressing, and here, this one is going better. Yes. Maybe someone was working on the shoulder before because you were complaining, but this one is going better in here. But on the last stage, it's a little bit pain. Yes, then we can check how much rotation we have in the hip. Yes, so here is 45, it's good. But here we should be 15, and we have maybe 3. Yes, okay. And then other side, let's see. So here is less. Yes, so that one was 45. This one is maybe 15. In here is better rotation, internal rotation. So internal rotation here we have 10, maybe 5 missing, but here is better. So external rotation is better on this side. Yeah. So we have imbalance between the both rotations. Then what we can check if how much hip flexion do we have. So hip flexion, if I press in here, Thomas test is showing that there is a and there is a hip flexor and so on. Yes, is overworking. And other side, let's see here. Okay, here looks a little bit better, but also yes, under pressure here. Where I can, by the touch, I feel that the psoas is very tight. Yes, then we can bring this leg across and see how the muscle tape is looking like. Yes, so from here, okay, so we can see that this shoulder, we can come from this side. Yes, come here, and you can see, we can see in here. Yeah, how much the scapula is away from the ground. Yeah, so this is showing us how the muscle tape is pulling from the leg, from the hip through the lower back. Yes, going all the way to the back, and is limiting and compressing in here on the neck and shoulder. That's why we have problem in here with the shoulder. Okay, and other side. Okay, this side is worse. Yes, as we can see. So this shoulder is going to be dependent more from this hip in that position, and I feel that there is a lot of tension here, yes, and pain, and see how higher, even more higher than the other side. Yes, so this is putting so much pressure and tension on the shoulder because of the hip. Yes, okay. Yes, now let's lay down on the chest. So we're gonna flip over. Perfect. And now this is a test for the glute strength. Yes, so if I'm gonna press in here, just lift the leg for me. Yes, more. Okay, so I feel the glutes is working, but not that strong, not that active like it's supposed to be. And where the pressure goes, yeah, one more time, shows he's rotating already. Yeah, so when I press, demanding from him, he's already rotating from that side. Yeah, so also it generates the compensation, yes, going on his back. And you can feel that there is a lot of pain. So instead of using properly glutes, the pressure transfer up, yes, on the muscles which are running close to the spine. Yes, so, and other side. Let's go one more time. Go. Again. Yes, here is same thing. And the glutes, he's supposed to be able to lift this leg, yeah, against me. There is not much, yeah. So there must be some problem with the lumbopelvic hip core, yes, related, yes, that's why. Do you feel the lower back pain, sometimes pressure? A lot, yes. Then do not let me to, yes, open, so you're closing the more stronger. Oh, should be more strength here, yes. And opposite, don't let me, yeah, oh, also not able to resist. One more time. Yeah, so either abductor and adductor have some weakness, yes. Okay, now we're gonna go to the side, go, side, okay. And don't let me push this leg down, yes? So you're resisting. Go, 1, 2, 3, hop. 2 fingers, yes. So lateral hip glute strength, yes, is missing. So we don't have the strength in here. So there is no stability for your pelvis. So I know that must be some issue, either is overworking or is not strong, not stable enough, yes? And going, hop. And again, 3, 2, 1, go. Oh, also. Yes, it should be able, normally, if it would be everything okay, should be able to resist the pressure. So this one is even weaker. Yes, as we also notice that you're standing on one side, so this one is a little bit stronger, the other one totally, yes, but both not active. And that can cause the problem with the, yes, balance in the body in the same time. Okay, we know the imbalances now, then we have to properly address them and fix.